Hello, my name is Anna and I'm a women's health physiotherapist here in the Rotunda Hospital, and in this video I'm going to teach you how to do your pelvic floor exercises, and you will be able to do them along with myself and with Sinead, who is here with me, who's 35 weeks pregnant. If you are unsure of where your pelvic floor muscles are, please have a look at the video called Finding My Pelvic Floor Muscles. So Sinead, have you done pelvic floor exercises before?
Yes,
okay,
I have.
You have. So when you're doing your pelvic floor exercises, first of all, you need to choose a position to do them in. So if you hadn't done them before, or if you have weak pelvic floor muscles, we would encourage you to do them lying down on your side until you feel confident you have the right muscles working. Okay? But once you're confident doing your exercises lying down, it would be important to progress them onto sitting, then onto standing, and then on to activities like walking, like doing exercise in the gym as well, just to ensure that your muscles are as strong as you need them to be during your daily life. Okay? So once you've chosen the position to do them in, then you need to find your pelvic floor muscles. So think of the three openings in the pelvic floor: the back passage, vagina in the middle, and the small bladder opening at the front called the urethra. So what we'll do is we'll sit forwards in the chair slightly and let's have a go at doing this. Okay? So think of the three openings: back passage, vagina in the middle, bladder opening at the front. Now tighten around the back passage as if you're stopping wind. Tighten forwards around the vagina as if you're tightening around a tampon. Tighten forwards again as if you're stopping your bladder, and hold it there and gently let go. If you're doing this exercise correctly, nobody should see you doing anything by looking at you. Okay? Some common mistakes that people make are that they pull in their tummy or they squeeze their buttocks, and they're the wrong muscles. Other people, they might hold their breath when they're doing the exercise, or what some people might do is actually push down and strain against their pelvic floor rather than squeezing and lifting, and that will actually further weaken the pelvic floor rather than strengthening them. Okay? A further mistake is that people actually stop and start the flow of their urine when they're doing their exercises. And we really discourage women from doing that as an exercise. It is okay to do it as a once-off test, but not as an exercise. And if you're doing your exercise correctly, what you'd find is that you're able to stop or slow the stream of your urine when you're on the toilet. Okay. So now that we've found the pelvic floor muscles, the right muscles, let's do a set of them. And for healthy pelvic floor, you need good strength and you need endurance as well. Okay, so we'll sit forwards again, hands on the thighs, and just slightly lean forwards with your back nice and straight, just so that your pelvic floor are against the chair. Thinking of the three openings again, we're going to tighten around the back passage as if you're stopping wind. Forwards as if you're tightening around a tampon, forwards again as if you're stopping your bladder, and now hold it there strongly for a count of 5, 4, 3, 2, 1. Release and relax, and we're going to rest for 5 seconds. Now we're going to do that a further 5 times, and you can do this along with us. So when you're ready, tighten again as if you're stopping wind, as if you're tightening around a tampon, and as if you're stopping your bladder. Hold it there as strongly as you can. 5, keep squeezing. 4, 3, 2, 1. Release and relax. And you rest for 5 seconds. And then again, tighten strongly as if you're stopping wind. Forwards as if you're stopping your bladder. Hold it. 5, keep breathing. 4, 3, 2, 1. Release and relax. So just make sure you're not holding your breath. You continue to breathe normally. And again, tighten strongly as if you're stopping wind. Forwards if you're stopping your bladder. Hold it there strongly. 5, shoulders relaxed. 4, 3, 2, 1. Release and relax. Okay.
Getting easier.
Getting easier? Yeah. So we'll do one final one. So when you're ready now, tighten strongly as if you're stopping wind. Forwards if you're tightening around a tampon. Forwards again as if you're stopping your bladder. Hold steady. 5, 4, 3, 2, 1. Release and relax. Okay, so some of you might have found that 5 seconds is too easy, so you can increase the number of seconds you're holding for, and you can increase the number of repetitions as you get stronger. So your ultimate goal for strength will be a 10-second hold,
Right.
10 in a row in standing.
Okay.
Okay.
Right.
So that was for strength, and now we need to work for endurance. So for endurance, we're going to do fast, repeated holds. So it's like a yo-yo. You're
Okay.
going to tighten up quickly and strongly and let go fully. You
Right.
tighten strongly, let go fully. And let's see if we can do 10 of these, okay? And again, keep breathing.
In the same position?
Same position.
Okay.
Keep the tummy nice and soft, the buttocks nice and relaxed as well. So when you're ready, tighten strongly around all 3 openings and let go fully. Tighten strongly and let go. Tighten strongly, let go. Tighten strongly and let go. Tighten strongly and let go. That's 5 done. Tighten strongly, let go fully. Tighten strongly and let go. 3 more. Tighten strongly, let go. Tighten strongly, let go. And last one, tighten strongly and let go.
Okay.
Did you feel the muscles working
Yes,
hard?
yes.
So your ultimate goal there for endurance is to do 20 of
Okay.
those fast contractions in standing.
Right.
Okay.
How many times a day?
For strengthening, you need to do these exercises a minimum of 3 times a day for them to
Right.
have any benefit, okay? And
Okay.
really the trick is to remember to do them. So
Okay.
try to link them with something that, you know, that you do a few times a day, like washing your teeth,
Right.
as you're walking, as you're sitting at your desk and work, but something that takes, you know, that takes enough time for you to complete your program.
Okay.
Okay, and it is really important to start doing this exercise during pregnancy, as you already have started doing,
Yeah.
but that you continue to do it for the rest of your life.
Right.
Okay, because if you don't use them, you lose them.
Okay.
All right.
Right.
So finally, the other thing that we recommend you to do is something that we call the knack. Have you heard of the knack?
I think I may have all right.
Okay, so the knack is the skill of being able to tighten your pelvic floor against an increase in pressure, like coughing, sneezing,
Yes.
laughing, common things
Okay.
that might cause a leak during pregnancy. Okay, so as you take a breath in to cough, you tighten your pelvic floor strongly, you keep them tight throughout the cough, only let go when the cough has finished.
Right.
So we give that a go?
Yeah.
Okay.
Same
So
position.
same
is it?
position,
Okay.
okay. So you're going to take a breath in, tighten your pelvic floor strongly, and just give a cough, keeping your muscles tight. Okay, so what that will do is keep your muscles trained and will always prevent a leak as well if
Okay.
you're doing it correctly.
Right.
All right.
Okay.
So first I'd like to say thank you to Sinead for joining us today and doing our pelvic floor exercises with us. If you've recently had your baby or you are pregnant and you have questions, please talk to your women's health physiotherapist, your midwife or to your doctor. And I hope this video has been helpful in teaching you how to do your pelvic floor exercises.